Hello and welcome. This week is all about knee pain. We're going to go over some of the most common types of knee pain and what can cause this from a muscular standpoint. So first, let's start with inner knee pain. So if you're having sharp pain or dull pain on the inside of your knee, sometimes for people this can feed up into the groin muscle as well or extend down into the inside of the calf. Let's talk about it. So what I want you to think of and what I want you to visualize is every muscle in your body has a muscle that works opposite of it. That's how we go around and move around in the world and do the things that we need to do, okay? So an example of that is the muscles on the inside of your leg. So this is one of your groin muscles, one of your hamstring muscles, and this muscle called a sartorius. Both of these, or all three of these, go and insert onto the inside of your knee, okay? The muscles that work directly opposite of it go and insert onto the outside of the knee. So this is your IT band. This is a muscle called your gluteus medius, a muscle called your TFL. This controls movement of your leg to the outside. These control movement of your leg or your knee to the inside. So if someone is having some inner knee pain, that tells us that something in the system that controls inner leg movement and outer leg movement has gotten off kilter and is giving them knee pain to let them know that something needs to be addressed, okay? What's important for you to know is a lot of times this inner knee pain can sometimes get diagnosed as a meniscus tear or a meniscus strain. Now, what research is showing us is that not everyone can avoid meniscus surgery, but about 60 to 70% of people are able to rehabilitate their knee without having surgery. So I want you to have that information in case you've gotten some inner knee pain and are worried or concerned about it, or maybe you've been doing some Googling. We've all done it. So again, this can be this inner tendon going and inserting the knee, can also be your meniscus, and we know about 70% of people are able to avoid surgery and return to their normal function if that's what's causing that inner knee pain. If you have any questions about that, you can always reach out to me or your trusted healthcare provider, all right? So now let's talk about outer knee pain. So again, we've kind of already covered this system. This outer hip muscle called your gluteus medius, a few other muscles go and attach into your IT band and go into the outside of your knee, all right? So again, if someone's having some outer knee pain, that tells us something with this outer system and inner system has gotten off kilter. We need to do some additional assessment and see why. Oftentimes what the treatment looks like for this is strengthening the muscle through the outer hip. That can help to calm down outer knee pain, can also help with some other types of hip pain called hip bursitis, which I've talked about on here previously. What's important for you to know is that this is part of one whole system. This can also be a factor in something called peroneal tendonitis, which is this outer calf pain, which extends into the outside of the ankle. Most of us know what this muscle is if we've ever had an ankle sprain. That's the muscle that gets affected with an ankle sprain. So really this is one big system, and what an assessment will let us do is figure out where in the system we need to give someone exercises or stretches, and that can help to calm down this outer knee pain. All right, so we've talked about inner, we've talked about outer. Let's talk about pain in the back of the knee, okay? So there's a muscle in the back of your knee called your popliteus or your popliteus. And that muscle has a very special role and a very special job. What it does is actually rotates your knee joint. So your knee joint kind of twists like this. That's a good thing that your knee rotates. Your hip rotates with it. And this is what allows you to turn around if someone says your name or make quick turns or things like that. That's where the rotation comes from in our leg. Now, what can happen if the rotation in your knee or the rotation in your hip, because we know that they work together, isn't moving in an optimal way? Someone can start to either get pain in the back of the knee, pain in the hip, or pain even on the outside or the inside of the knee. And what we want to focus on there is restoring the rotation in the knee joint, and then looking at how the hip is needing to rotate as well. And these often look like mobility and flexibility exercises that you can learn to do at home, okay? So we've covered inner knee, we've covered outer knee, we talked about back of the knee. Now let's talk about pain in the front of the knee. So this can get diagnosed as several different things. Sometimes people will get told they have patellofemoral syndrome or patellar tendonitis, runner's knee, jumper's knee. Several different names can be given to pain in the front of the knee. And the important thing to know here is that this can have several different causes, okay? And what's most important is that we look at this from a really holistic perspective, because ultimately we know that the calf and ankle, the knee, and the hip all work really closely together. So when we're walking, we're lunging forward in space, we're running, you're hiking, whatever it is that you're doing, all of these are working really closely together. So if we say, for example, when you're running, and I'm gonna very much rough these numbers just for demonstration purposes, all right? Let's say your calf is doing 60% of the work, your knee is doing 20% of the work, and your hip is doing 20% of the work. If your calf on one side is only doing 40% of the work instead of 60% of the work, either your knee or your hip is going to have to work harder to make up for it. And this is sometimes what can happen that can lead someone to developing pain in the front of the knee. That is one of the possibilities. We're going to talk about some of the others, okay? Another really important factor to look at is how someone's ankle joint is moving. So if someone's having pain with squatting or lunging, for example, the movement in the ankle is controlled by your calf muscle here and the muscle in the front of the shin. And what we know is that the better your ankle joint moves, the more optimally your knee joint can move, okay? Same thing up here. The better your hip joint moves, the more optimally your knee joint can move. So sometimes irritation in the knee is more about what is going on from your calf and ankle from a strength standpoint or a mobility standpoint. Same thing with your hip. It could be what's going on from a mobility or a strength standpoint in your hip. It's important to look at all those different factors, okay? So then once we've looked at all the other factors, let's zoom in on this area a little bit more. So all of your quad muscles go and turn into this tendon that goes into your kneecap, and then your kneecap is connected from your kneecap to your shin by this ligament, okay? And so if someone's starting to develop a tendinitis or a chronic irritation in this area, then what we can do is use movement and exercise and strengthening to help facilitate changes in this tendon to help to decrease pain and improve overall function, okay? So ultimately, knee pain can have a lot of different causes as we've gone through today. What's most important is that we look at how all the muscles are working together in the knee, as well as how the knee is working with the other joints in the body. Okay, and while we're here, I'm going to go over one more aspect that I sketched out for you. So if we're talking about front of the knee pain, another thing to look into, especially if you are a runner or a hiker and you're experiencing pain when you run or when you hike down hills or run down hills and things like that. Another thing that can impact how much pressure is going through the front of the knee, is something called a shin angle. So I've roughly sketched this out for you here. So if you imagine this person's walking forward in space, and we freeze the frame and we look at how far is the heel extended either in front of the knee or behind the knee, okay? And what we know is if someone's heel is extended way past the knee, that's going to drive additional pressure into the knee joint. So if someone's having pain with running downhill or running or hiking downhill or things like that, then what we can look at is decreasing this angle to decrease the amount of pressure going through the knee, okay? So again, that just goes to show you there's a lot of different things that can influence knee pain. The good news is that because there are a lot of things that influence knee pain, there are just as many, if not more, solutions available if you are experiencing it. All right, I hope this video was helpful for you. Please put your comments or your questions below and I'll be sure to answer them, and I hope you have a great rest of your day.